All right, I think we're live on YouTube. Unfortunately, I sent out an email and there was a specific link for YouTube, and the way Zoom works, you could connect it to, it's a little bit, well, and yeah, anyway, if you're, I was gonna say a little bit complicated, at least for me it is, but anyway, so I'm live on YouTube, but some people might have some technical difficulties trying to, go through the link that I sent in the email, but hopefully they will find me. And I also didn't, I forgot to post it on Facebook. So we might have a smaller crowd today as well, which nothing wrong with that. But yeah, thanks for joining me. And, I've been doing these mostly during the day, but decided to do an evening one just for those who can't make the day sessions. So I, again, appreciate you taking time out of your Wednesday evening. I know there might be some people, I got at least one email, someone from New Zealand. And, so this time of the evening, there might be some people from New Zealand, Australia attending, maybe even some people from Europe, even though there it's the middle of the night, like 1, 2 o'clock in the morning. So probably won't be too many people from Europe, but feel free to let me know where you're tuning in from, whether you're on Zoom or on YouTube. And and feel free, you could start also typing in your questions. And once I get through a few announcements, I'm just going to dive into the questions. So let's see here. So, and yes, Lisa, yes, this is where you would ask questions. So, so yes, definitely, you could start typing in your questions. And we have Lori Zooming from Florida, and Terry from Sudbury, Ontario, Canada, and then Sparkle from Pennsylvania. All right, and let's see if anybody, let me see if I could send, again, like I said, there's people, I think, waiting on the other YouTube, the link I sent out, which, so just give me another minute, please. Sorry about this. Just gonna put a little note here. All right, let's see. A few other people typed in where they're Zooming from. We got Suzanne from Kansas, Janine from Georgia, and Robin from Washington, D.C. And we got Colleen from Arizona, Annette from Florida, Debbie from New York State, and then Anne from Maryland. All right, good deal. And all right, so let's go ahead. I'm going to, again, give a few quick announcements here. So first of all, I'll be having a free 5-day challenge. I've been trying to do well, last year I did a few longer challenges, and I did my first 5-day challenge last August. Then I did another one in February. So the goal here is to do at least 3 or 4 this year. So this will be number 2. And so I'll be having and they're all different. They're different themes. So in February was a hyperthyroid healing challenge. This one is an accelerated thyroid healing challenge. So it's not just for hyperthyroidism, but those with hypothyroidism, Hashimoto's as well. It'll be starting on Monday, May 17th. And so the way it works, if you haven't been a part of my previous challenge, it's completely free. There'll be daily 10 to 20 minute pre-recorded lessons and assignments. And so those will be emailed to you. So you do need to register, and calls will be live on Zoom, and I'll be live streaming them into my Facebook group. So it won't be live streamed to YouTube, but to Facebook. And I'll be rotating the times to accommodate those in different time zones. And there will be prizes for participation. A lot of fun, the challenge. At least I have fun, and a lot of people have fun. Those who participate seem to have fun. Again, registration is not available yet, but it will be soon. Probably going to send it out either over the weekend, or the latest will be Monday, which again, May 10th. So no later than 1 week before it starts. And again, it'll be a live stream into the Graves' disease Hashimoto's Facebook group. So you don't have to be a member of the Facebook group to participate. However, that's where a lot of the action takes place in the Facebook group, meaning that the engagements. So for the contents, the recorded lessons, and then every day I will have live calls as well. So again, you don't have to be on Facebook. Some people who don't want to be on Facebook permanently will set up temporary profiles so they can engage with each other. And again, the prizes and all that, like the contest, the way it works is I post like a question of the day, and it does takes place in the Facebook group. So if you want to participate in the prizes, that will be taking place. Let me just make sure everyone can hear me, because there's a lot of activity. Okay. Well, someone says hearing a lot of static, but someone else says sounds clear here. All right. Am I okay? Do I sound pretty clear? Hopefully I'm not staticky. So I think okay, everything's good. Okay, just making sure. All right. So anyway, definitely take advantage of the challenge. I'm going to go about an hour after, not including this, like once I start answering questions, I'm going to go about an hour. I might not get to all questions just because there's a good number of people. Maybe it's a good thing I didn't post it on Facebook, but anyway, so if I don't get to questions the week of May 17th, I'm going to, and the calls, I'm going to rotate the calls. So I will have both day calls and evening calls. So again, my goal during the challenge is really to answer at least all the important questions. Even then, I can't promise all, because some people just keep on asking questions just for the sake of asking questions sometimes. So at least the goal of that week is to answer the most important questions. And of course, I'll try my best tonight too. And then one more announcement. For those who have Graves' disease, and specifically thyroid eye disease, even though some people with Hashimoto's can have thyroid eye disease, but usually it's with Graves. So I had Facebook Live, and I did send out the recording. I uploaded it to YouTube, but there was an interview with Dr. Ronnie Bannock, who's a board-certified ophthalmologist, and we spoke about thyroid eye disease, both natural and conventional treatment methods. And so originally the goal was just to interview her, but then a few days before, she asked she spoke with me about doing a master class. And so, and first I thought it was just going to be her doing the master class, but so she suggested for me to join the master class. So again, this wasn't really planned this time last week. It was, or maybe it was like a few days before she brought it up. But anyway, for more information on that, again, I did send out an email. thyroideyediseaseclass.com. And again, she's offering 50% off if you register by Friday, May 7th. So the price is $99, but so 50% off at $49.50 if you register by this Friday. And you would just use the coupon code TED. So again, if you obviously if you don't have thyroid eye disease, this wouldn't apply to you. But if you do, you might want to consider checking it out. All right, cool. We do got some people on YouTube as well. So you found me on YouTube. So I'll be going back and forth between YouTube and I'm not YouTube. Yeah, YouTube and Zoom. Most of the action is on Zoom. All right, so I think that is it. So let's go ahead and answer questions. And also just one other thing for when it comes to the answering questions. So what I try to do my best when it comes to questions is, just spreading the wealth, meaning that if someone is dominating, like asking a lot of questions, again, I'll try to get to as many questions as possible, but I'm going to, try to get to as many people as possible. My goal is to try to answer at least, a question from everyone who has a question. So if like someone has like 3, 4 questions or more, I'll at least try my best to get to one question. And again, I might get to multiple questions, but just some people are faster typers than others. Some people might not have a question until a few minutes into the presentation. All right, and yes, and it never fails. There's always people who like to draw during the presentation. Let me see if I could clear these. There we go. So I'm learning a little bit more with Zoom, even though I've been doing this for, I mean, I've been using Zoom for a while, but usually when I do like one-on-one consultations with Zoom, the person's not drawing. So it's just when doing these group calls here. So, all right, let's get into the questions here. And so let's scroll down. So question, and if someone asks a private question, I'll try not to remember not to announce the person's name, but I'll of course still announce the question so everybody could hear the question. So the first question, how do you find out the root cause of fatigue? Mine is primarily at night after working, but no umph left after 5, ready for a nap. So yeah, sometimes it is challenging. There could be a lot of different factors that cause fatigue. And I believe you also put in that you've been diagnosed with Hashimoto's. So again, there's a lot of different things that can cause fatigue. And yeah, anyway, I was gonna say if the person could, just delete what they're drawing. But anyway, I guess it's not a big deal. If someone really wants to draw, go ahead and draw away. I guess I'm done with the presentation part. So, or the announcement part. Yeah. So fatigue, there could be a number of different causes. So with Hashimoto's, sometimes it is related to thyroid hormone being low, and it might not be overtly low. It might be just on the lower side. But within the lab reference range, so less than the optimal range. But they're adrenals. So I do recommend testing adrenals for most people, nutrient deficiencies, infections. And so with most healthcare practitioners, we choose starting points when it comes to trying to find triggers, underlying imbalances. I mean, there are some practitioners that, like spend or at least recommend thousands of dollars worth of testing. I can't say I take that approach, but yeah, definitely look at a thyroid, look at adrenals. I can't say I always dive into infections right away, but certain infections, Epstein-Barr, stealth infections, Lyme disease, co-infections, but again, nutrient deficiencies, simply an iron deficiency can cause problems with fatigue. So even a lot of inflammation, and of course, things like not getting enough sleep. So, that's where a health history, trying to play detective and just seeing, what, if the person, so as far as yours is primarily at night, after working. So again, it might like something like an iron deficiency probably wouldn't be the main cause because you figure that you'd have fatigue like throughout the day if it was something like that. And, perhaps even with thyroid, but adrenals, that could play a role as well. Sometimes if there's differences throughout the day, blood sugar imbalances can also be a factor. But yeah, sometimes it is challenging, but with everybody, I do not only thyroid testing, but I usually do recommend adrenals. Nutrients, I do recommend looking at nutrients. I like hair testing, but hair is not completely reliable for everything. So I also like blood testing too. But there's no perfect test when it comes to nutrients. So even though there are some panels like SpectraCell and the NutriVal from Genova, but still there's not a whole lot of research behind the testing. when it comes to like panels that look at, every single nutrient out there. Okay, so Robin, question, my TPO antibodies are elevated, so 31 times 60 another. My other thyroid markers seem to be okay. What would you recommend doing about this? I have autoimmune atopic gastritis, so I'm prone to autoimmune issues. So, yeah, so, I mean, first of all, I mean, TPO antibodies, you can't always go by the levels, but I will say that I have patients where they're in the hundreds, sometimes in the thousands. So by comparison, 30 to 60 is not too bad. That being said, I mean, it's still, even if thyroid is looking good. So also, as I mentioned earlier, you need to not only look at the lab range when it comes to the thyroid, but also the optimal range. So if TSH, like optimal TSH is between 1 and 2, but like I think it was today where one of my patients, the TSH was in the threes, like 3.5 something. So it was within the lab range, but outside optimal. And then, thyroid hormone levels, same thing. And thyroid hormone levels, it depends on the units you use, which can vary depending on the lab and especially in different countries. But usually I like to see free T4 between 1 and 1.5, free T3 between 3 and 3.5. Again, that might vary depending on the reference range. So if someone has a free T3 of like 2.4 or it's 2.3, 2.4, that may very well be within the lab range, but less than optimal. So you need to consider that as well. And I'm just bringing it up because you said the other markers seem to be okay, but you don't always want to go by the lab range. And so I would still try to do things to improve your immune system health, even though they're not extremely high, they're still above the range. So, I would still try to work on diet. I mean, that's number one, even though diet alone isn't the only solution many times, but it is the starting point. So you want to make sure eat a clean diet, diet and lifestyle. So diet, stress management, proper sleep. But you might need to dig deeper. You might need to, again, do some adrenal testing and maybe look into things such as infections, doing things to reduce your toxic load. And yeah, so again, I mean, what I start with so I start patients with a health history, and I'm getting back to like the question the person asked before about root causes. So same thing in your situation, like where do you get started? So like I said, diet, lifestyle is where I definitely would start. But then if someone's wants to, go and do some testing, I would say to look at adrenals. I like either saliva testing or dried urine testing. Like there's what's called the Dutch test. Again, I like hair testing, even though it's not perfect, but it all comes down to an interpretation. And then I do certain blood tests as well. And especially since you mentioned in parentheses that you're prone to autoimmune issues, again, I definitely would. That's another reason why I wouldn't ignore it. All right, so Janine and Joe, as you may know, NP Thyroid has now recalled their product for a third time in a year. This time because it's not strong enough. I feel very tired and feel like I need to just find an alternative and get off the meds. Do you have any suggestions? My TPO antibody is usually above 100. And also let me mention that for those on YouTube, I will get to you eventually if there's questions. I'm going to probably go until 8:30 answering questions on Zoom. Go to YouTube for a few minutes if there's questions, and I'll go back to Zoom and kind of go back and forth. But so we'll go again another 10 minutes or so on Zoom, and I'll go until about 9:15. And like I said, if I don't get to a question the week of May 17th, definitely sign up for the challenge, and I'll be sending out an email, multiple emails, starting even the weekend or next Monday. But yeah, so yeah, there's been issues, of course, with not only NP thyroid, but nature thyroid and WP thyroid, Armor, in the past. I don't think recently it was recalled. So I mean, I guess Armor is, or, going to, compounding pharmacy, which I know is more expensive. There are also glandulars. Unfortunately, one of the better glandulars that recently I've been recommending, one called Thyrogold, is something to look into, but unfortunately they've been out of stock for a while. But they have recommended an alternative, and I don't, off the top of my head, I don't know the alternative. I'd have to look it up. But if you contact Thyrogold, because again, the only reason I learned is a patient contacted Thyrogold, and they told the patient, they gave the patient an alternative to the Thyrogold. There's also something called GTA or GTA Forte by the company Bodix Research. Again, I'm not telling you to take these, but these are just some alternatives, like that I would tell my patients. I can't give specific recommendations here and say to, take this instead of the NP thyroid. But if a patient of mine is taking, was taking NP thyroid or another type of desiccated thyroid and they weren't able to get it, then I might give them something like Thyrogold, or again, the substitute. And their website, so my website is Natural Endocrine Solutions, and sometimes I joke because their website is Natural Thyroid Solutions. And if I had to do it all over again, I might have chosen that website, Natural Thyroid Solutions, since my main focus is on thyroid. But anyway, so Natural Thyroid Solutions, again, I'm pretty sure the Thyrogold is still out of stock, but you could always ask them about the alternative. So Anita, have you heard anything about the new drug Tepezza for thyroid eye disease? Yes. So again, and let me bring up, just if you've missed, well, you probably didn't miss because this was asked like 8:06. So probably before I made the announcement. But again, I had you don't have to attend the masterclass to learn about Tepezza. You could actually, I wrote an article, so you could visit my website, naturalendocrinesolutions.com, and then just do a search for Tepezza, and I wrote an article. And then last Friday, I did an interview with Dr. Ronnie Bennick. And again, that interview is on my YouTube channel. I uploaded it to my YouTube channel, Natural Thyroid Doctor. And so, she spoke a little bit about Tepezza, as well as another biological agent. All right, so Margot from Washington State is on with us. Thank you for joining. And okay, so Sparkle question: I had recent blood work done, iodine, serum, plasma, and my results came back really high. How does that affect the thyroid? I don't rely on blood when it comes to testing for iodine, and not only just iodine, but other minerals. Like if you're, if you test B12, which I do test B12 in the blood at times, even though methylmalonic acid is a better indication, especially urinary methylmalonic acid. But if you, they're not completely reliable. If you're consuming any source, like eggs are high in iodine, not as high as iodine as, like seaweed and things like that. But if you eat foods with iodine, that could cause the number to increase in the blood, and that's not necessarily having a negative effect on the thyroid if it's high in the blood. So I prefer urinary iodine testing, even though that's not perfect either. So I've had a thyroid uptake scan that showed hyperactivity on the right side of my thyroid. Radiologist said it could probably be artifact. However, I'm having crazy symptoms. All my thyroid panel, including antibodies, are in range, except TSH. It keeps fluctuating, so I have subclinical. Should I treat this as hyper? I'm also 5 months postpartum. Yeah, maybe. I mean, it might also be Hashitoxicosis, even though you said the antibodies. I guess the question is, even though you mentioned antibodies are in range, so I'm wondering if they did all three of the main antibodies. So there's, so the antibodies are for Graves, it's TSI, or thyroid stimulating immunoglobulins. And then there's TPO, or antithyroid peroxidase antibodies, and then there's antithyroid globulin antibodies. So if TSI is negative, then it's probably not Graves. And And that wouldn't be a surprise because most cases of postpartum thyroiditis, Hashitoxicosis, usually you're going to see TPO or thyroglobulin antibodies, and sometimes both. But it makes me wonder that they just maybe not test, all three, or maybe they tested TSI, but they only tested TPO and not thyroglobulin antibodies. So as far as should you treat this as hyper, I mean, you could, I guess, I don't know what you had in mind. Like if your numbers look good, like even if TSH was, a little bit lower, on the more on the hyper side, but thyroid hormone levels look good, something like anti-thyroid. I mean, you wouldn't be able, of course, to take anti-thyroid meds unless it was prescribed, but anti-thyroid herbs such as bugleweed, yeah, I would visit the website, my website, naturalendocrinesolutions.com, do a search for Hashitoxicosis. And because I talk about that, like if someone has Hashitoxicosis, should they take bugleweed? Because again, the risk of that is that they, it's usually transient. And in your case, maybe it's not transient, but again, you do say it keeps on fluctuating. So, but it's more of a subclinical hyperthyroidism. TSH, I'm assuming, is low, but thyroid hormone levels are normal. I do talk about things like motherwort, maybe as an option instead of bugleweed, because motherwort, hawthorn's another option that will help with the cardiac symptoms without directly affecting thyroid hormone. All right, let's go here. All right, so oh, okay. So someone, okay, hey, stay in your lane. You can't fix your name. Yeah, if you want to change your, oh, actually, maybe it might be the settings. Yeah, I apologize. Yeah, it might be where usually I don't have any problems people changing their name, but I might have. I think by default, it's like checked where people can't. I don't know. I'm not sure if actually can I. Yeah, I was gonna say I don't think I could do anything here as far as with the share up as far as so anyway, sorry about that. So Kay has a question, and we'll answer one or two more questions, and we'll go to YouTube, see if there's any questions, and then I'll go back here to Zoom. So can nodules on the thyroid impact thyroid function? The thyroid test that I've gotten come back normal, but I have a lot of the symptoms of poor thyroid function. I mean, it can more commonly nodules will see it lead to hyperthyroidism more than hypothyroidism. There is a what's called toxic multinodule goiter, where we see hyperfunctioning nodules, where the nodules can potentially cause hyperthyroidism, and sometimes we see just like multinodule goiter, where the person's not, it's not toxic, they're not hyperthyroid, but we might see kind of like subclinical findings where TSH is on the lower side, but thyroid hormone levels look good. All right, so Carol here, are anxiety and brain fog related to Graves? What can help? So yeah, especially the anxiety. So the number one thing that you could do, and again, I've written an article, and I'll answer your question also, but I go into a lot more detail whenever I bring up articles, just because the article I'm going to go into a lot more detail. So, so I would say just visit naturalendocrinesolutions.com and visit, I mean, do a search for anxiety, but the hyperthyroidism itself is a huge cause. So like lowering the thyroid hormone levels is very important. So, so hopefully you're working on that. I mean, some people do need to take anti-thyroid medication. I personally took the herb bugleweed, which worked wonderful for me. And for a lot of my patients, it works well, but not for everybody. Some people, it just doesn't do the job and they need to take something such as methimazole or, in some cases PTU, but usually it's methimazole, tapazole. If you live in another country, sometimes it's carbimazole, which converts to converts to methimazole. But yeah, so that number one would be the elevated thyroid hormone levels. And then, also, hyperthyroidism could lead to certain nutrient deficiencies like CoQ10, magnesium, that could also, like magnesium has a calming effect. So some people find, find that supplementing with magnesium could help. That usually is not going to cause a brain fog. CoQ10, sometimes with the brain fog, more so like lower energy. And then also, gut. So Graves is autoimmune, and a lot of people with Graves that have gut problems. A lot of people with autoimmune conditions have gut problems. There's what's called the Triad of Autoimmunity. So the three factors that can cause autoimmunity to develop. We have genetic predisposition, which that we can change, but exposure to one or more environmental triggers, and then an increase in intestinal permeability, which is a leaky gut. And so doing things to heal the gut. So people don't think about the gut when think about anxiety, but most of the neurotransmitters are actually located in the gut. And there's a psychiatrist, a functional medicine psychiatrist, Dr. Kelly Brogan, and she has a book. I think it's a Mind of Your Own, where she talks about the relationship between the gut and anxiety and depression. So number one, lower thyroid hormone levels. Again, maybe consider something like magnesium, but then also look into the gut. And again, visit my website, naturalendocrinesolutions.com, and do a search for anxiety. Okay, so I'm going to go to YouTube and I will come back here and so let's see if they're quite, oh wow, there's a lot of activity on YouTube. Again, not as much as the Zoom, but all right, so I have Hashis and celiac. My TSH is 13.40, which is pretty high. And my T4 and T3 is on the low end of normal. And gluten makes me tired, water retention problems. So yeah, it sounds like, yeah, so definitely you need, to try to find out, of course, what, what's causing that. I mean, that's the goal. I mean, some people do need to take thyroid hormone replacements, sometimes on a temporary basis. Some people do need to take it permanently, but either way, the goal is to find out why that's the case. And also, I don't know if you got tested for antibodies to see if you have Hashimoto's, see if it is autoimmune. Okay, Roxana, how can you lower the testosterone? So again, it depends on what's causing that. If someone has high testosterone, it depends on the cause of the testosterone. So DHEA is a precursor to testosterone, so you want to make sure DHEA is not high too. But sometimes blood sugar issues is a factor with testosterone. So if someone has, insulin resistance, for example, that and hopefully it says my screen sharing's paused, which isn't a big deal because I'm not really just going through the motions of answering questions. So yeah, so anyway, I would look into, making sure, of course, I assume you're not taking testosterone, but also if someone's taking DHEA, that could cause elevated testosterone. But, assuming that's not the case, then looking into things like insulin resistance as well, and making sure you could always have false elevations, false readings, period. So if someone gets a single reading, a single blood test and testosterone's high, and if you have a history of high testosterone, then I would believe that reading. But if that's like the only time that was tested, then it is possible. Like I wouldn't go crazy trying to lower it before doing maybe another retest. All right, so, and then here it's gluten is poison. That could be a trigger. Yeah, that is true. Gluten can be a trigger. So Gabrielle says here, my TSH is always always below 0.01. Will methimazole ever fix that, or does it only affect the T4? It depends. So if it's pituitary, then yeah, like if it's a pituitary issue, then it probably won't affect the TSH. So if you're subclinical thyroid, subclinical hyperthyroid, it might help. It's not going to fix the problem. So when you say, will methimazole ever fix that? So methimazole doesn't fix anything. Methimazole is, sometimes it's important to take antithyroid medications. I'm not saying that someone should stop taking it if they're taking it, but you want, while taking the antithyroid medication, you want to do things to address the cause of the problem. So the methimazole might help, but again, it's not a permanent solution. Even if it does help, once you stop taking it, it's probably would go back. So yeah. And someone else here has normal TSH, high T4. Yeah, which again, it's hard just to say what what is the normal TSH is. Like normal, like again, there's optimal TSH of between 1 and 2, but according to a lab, a TSH of 3 and even like 4, according to most labs, would be normal. So if someone has a TSH, 4, but either way, if it's high, like so that's another thing too. If it's like high, so higher TSH and high T4 would be something like thyroid hormone resistance. But then also it could be less than optimal, like it could be like 0.6, and that would be more on the hyper side, but within the range. Okay, so how can you make Hashis go into remission without meds? So you want to, again, there's not a simple solution, but as I said, I would always start with diet, lifestyle. So clean up your diet. I usually recommend as a starting point, autoimmune paleo diet. It's not a perfect diet. Some people do fine just with a paleo diet. And then there's, if someone's a vegan, vegetarian, I mentioned like the plant paradox diet. But, so cleaning up your diet, stress management, getting proper sleep. But sometimes people need to dig deeper and try to do other things to find triggers, try to do testing, for example, as I mentioned earlier. You might want to visit Amazon, check out my book, Hashimoto's Triggers. You could it's a very comprehensive book. You could also visit my website, naturalendocrinesolutions.com, and there's plenty of free articles, but Hashimoto's Triggers, if you get the Kindle version, it's, I believe, $5.99 still. If you get the paperback, it's like $20, but $6 for the Kindle version. Again, very comprehensive, and you don't have to read it like from start to finish. Some people, I'm sure, do that, but I'm sure some people don't. Okay, so Stay in Your Lane is on YouTube too. I figured out how to change my name, though I'm on Zoom, and ask my questions in 2 parts. Okay. Okay, what do you think about thyrotropin PMG? Is it any good? So thyrotropin PMG, it's from Standard Process. So I do like thyrotropin PMG, thyrotropin PMG. It's a protomorphogen. And so what I learned by going to some conferences from Standard Process is that the thyrotropin PMG, it can help slow down the progression of autoimmunity. So it's not thyroid, it's not a thyroid glandular. It's not necessarily directly supporting thyroid, but it's kind of neutralizing the damage that the immune system is causing to the thyroid gland. So yeah, I think for, I don't know so much for Graves, even though some practitioners will recommend it for Graves, but for, people with Hashimoto's, it might be a good option. Oh, okay, I was taking NP thyroid and it made half my hair fall out. No thanks. Yeah, I mean, thyroid hormone affects everybody differently. So, Okay, and have problems with digestion and leaky gut. Also celiac, gluten intolerant. Yeah, so definitely. So I mean, obviously, avoid gluten, which you're probably already doing, but you might need to do other things to improve gut health. You need healthy gut to have healthy immune system. All right, so let's get back to Zoom here, and we'll probably get back to YouTube at least one more time, but we'll spend let's say the next 20 minutes or so on Zoom questions. Check back with YouTube. I'm going to take a quick sip of water here. All right, so how would T3, so Marlies here has a question, how would T3 affect the vocal cords, causing a voice condition known as spasmodic dysphonia in particular? I'm not referring to a rough and or deeper voice, but a whispery or broken voice or no voice at all. Thank you very much for your input, Dr. Eric. So I'm guessing you have more low T3. I mean, T3 is the active form of thyroid hormone. So, I can't say that most people, first of all, I will say that out of the majority of people I work with Hashimoto's, that most people are within the lab range when it comes to T4, T3. So it's usually, we see it like less than optimal. But, in those cases, like in something like that, most of the time, it's not going to have a dramatic effect on the vocal cords from what I've seen. But, once T3 gets below a certain range, and again, I'm not sure if that's the case with you, but, when T3 gets really low, there's that possibility. And then also goiter, like if someone has a goiter, a moderate to large goiter, and so that could happen with hyper or hypo. So if someone has elevated thyroid hormone levels, like I dealt with hyperthyroidism, Graves' disease, I had a mild goiter, and it didn't affect my vocal cords, but in some people with hyperthyroidism, it could be, but it's not due necessarily to the T3 itself, but the goiter, same thing. If it's too low, you could also have a goiter. But again, T3, as I mentioned, that's the active form of thyroid hormone. So it could affect, a lot of different areas of the body. And what's frustrating, that a lot of people have problems converting T4 to T3. So, a doctor might give someone with, in the case of like hypothyroidism, Hashimoto's, it might give levothyroxine, some type of thyroid hormone replacement that just consists of T4. Levothyroxine is synthetic T4, and they might, if they have a problem converting to T4 to T3, then that's not going to affect the T3, the low T3. So I probably gave you a little bit more information than you asked for, but let's see. So Margot, I have subclinical hyperthyroidism. Can you just explain it? And should I concentrate on the hypothalamus? Yeah, subclinical hyperthyroidism is tricky. Most of my patients are Graves' disease patients, and then next to Graves, the second most is toxic multinodular goiter. I don't work with a lot. I work with some subclinical Graves' disease patients where they have elevated TSI, but that, and TSH is depressed, but thyroid hormone levels are normal. So in that case, you still want to work on the autoimmune component. When someone is subclinical and everything else looks good, no antibodies, and thyroid hormone levels are normal, then yeah, I would agree. Like pituitary, I'm thinking that there's, something, it's more of a pituitary problem than a thyroid problem. And also you want to make sure you get a thyroid ultrasound. I guess you probably did, but if not, make sure that there are no nodules, because again, that could also have an impact. But yeah, I would say the hypothalamus, pituitary gland, the HP, the hypothalamus, you could say HPT axis, but again, HPT is hypothalamic pituitary thyroid axis. But it's, really focusing more on hypothalamus pituitary. And, but yeah, definitely I would, like I said, I would make sure, look at antibodies, because some people it's not too common, but there's subclinical Graves. So check thyroid stimulating immunoglobulins if you haven't done so already. And then also do an ultrasound, see if there are any nodules, because that could also have an impact. All right, so Esther here, and I'm trying my best. So far, it seems like most of the people asking questions are unique, like it's not the same person. So I haven't really had to skip around much. But I'm pretty sure I won't get to all questions. So I'm going to try, if there's people asking multiple questions, I'll probably skip over just to try to get to as many people as I can. But like I said, for those who trickled in late, okay, I just realized I didn't realize people could actually write, like, let's see if I could. Sorry, I realized someone wrote on looks like on the slides. I never had anybody do that. I'm cold all the time, and after I eat, I always, so I'm trying to see if I could clear that, which apparently oh, there we go. All right. So anyway, for the challenge, again, I'm bringing this up just in case if I don't get to your question, just be on the lookout for an email where the week of the 17th, I'll be doing a challenge. And again, I'll be live every day, different times, like, I'll be rotating the times. I'll have a few Q&A sessions. So definitely attend that. If you don't, even if you get your question answered, attend that, because there'll be a lot of good information. But Esther, does your thyroid make your body cold all the time? And do you always feel tired after you eat always? So what hypothyroidism, it's very common for people to be cold, especially cold hand and feet. And tired after you eat, I mean, so hypothyroidism, a lot of people do get fatigue, but if it's after you eat, that's more of a sign of hyperglycemia, insulin resistance hyperglycemia. So that's more usually blood sugar related. All right, so I've been on methimazole for almost 5 years. I want to get off of it, but how do I stop my levels from going up? So you want to, just, I don't mean to sound like a broken record, but find triggers, remove triggers, correct underlying imbalances. So again, attend. I'm going to sound like a broken record because I'm going to just keep on also bringing up the Accelerated Thyroid Healing Challenge. Definitely attend that, because that's, we're going to be talking about finding, removing triggers, correcting underlying imbalance, healing the gut. You could also visit my website, naturalendocrinesolutions.com, and I wrote a book, Natural Treatment Solutions for Hyperthyroidism and Graves' Disease, you can find on Amazon. Again, it's not necessarily an easy process. I mean, when I dealt with Graves, I took an herbal approach, bugleweed and motherwort, and those are not doing anything for the cause of the problem. It's just managing the symptoms more naturally. And, I was on the herbs for 9 months, so it wasn't like it was a quick and easy cure in my case. And even after that, I had to see, the next few blood tests, make sure things are stable. So again, there's no quick and easy cure. And also, as I mentioned, diet, just start with diet, lifestyle. But yeah, definitely attend the Accelerated Thyroid Healing Challenge. Again, I'll get an email out no later than next Monday, maybe before that. So be on the lookout for that. All right, so Tina from Pula, okay, I won't try to pronounce it. Tina from Washington. My low thyroid is new to me. Suspect Hashimoto's. When you get a moment, would you know of a good functional medicine doctor that specializes in thyroid? Not specifically. I know that, so there's the Institute for Functional Medicine. They're located, I don't know where in Washington, probably near the Seattle area. But you could also visit Institute of Functional Medicine's website. Just do like a search, Institute of Functional Medicine, and there's a link where you could search for a practitioner. As far as one that specializes in thyroid, yeah, I don't know. I mean, what you'll find is that most people will mention thyroid on their website, but they're not necessarily specializing in it. So, the good news in this day and age is, again, like before everything happened in 2020, I was doing remote consultations, but now a lot of other practitioners are doing it as well. So, I mean, I'm available for remote consultations for Graves and Hashimoto's, but so are other doctors. So you're not just limited to Washington. So if they're, um, I know some people still want to see someone face to face. And if that's the case, yeah, I would just, like I said, I would visit Institute of Functional Medicine, do a search, and you might find someone that's not too far away that focuses on thyroid. All right, so Henry, can I expect my thyroid meds to bring all thyroid meds, I guess you mean thyroid levels, to normal and all symptoms under control? Sometimes it depends. It really does depend on the person. There are some people, I don't know if you have hyper or hypo, but there's some people with hyperthyroidism that take anti-thyroid medication such as methymizole, and that does a wonderful job of bringing their levels back to normal and gets their symptoms under control. And same thing with hypothyroidism, Hashimoto's. There are some people that take thyroid hormone replacements, and and it really, helps with their numbers, brings things up to normal, and then also controls their symptoms. And then there's the opposite, where people are taking anti-thyroid medication and it's not helping, or maybe it's helping, but they're not doing well with the meds. And, same thing with thyroid hormone replacement. There could be other things, like, especially I see this a lot with Hashimoto. Someone will take thyroid hormone replacement, but they'll still feel lousy. And it's usually because there are other things going on, other imbalances that need to be addressed. All right, so Hanky here says I have low T4 and TSH, and low T4 and low TSH, weight loss, hair loss, fatigue, heart palpitations. I think I have hypothyroidism, but it could also be pituitary issue. Currently taking Armour thyroid and and T3 as well. Yeah, so if your T4 and TSH is low, you are correct. It could be also a case where it might be pituitary. So you're taking Armour, and you take, okay, so you're taking T3, but you didn't bring up T3, so I don't know what your T3 is, but yeah, so I wonder how long you've been taking Armour. Is the T4 still low? And then again, TSH, usually is high when T4. So yeah, I'm thinking maybe, like, again, as I mentioned earlier, a different situation like hypothalamus pituitary, but yeah, I might suspect that. And especially if low T4 and getting things like weight loss, you're getting like hyperthyroid symptoms, even though your T4 is low. It's yeah, and there could be other things going on as well. There are other things that could cause weight loss, malabsorption, for example. So yeah, hopefully you're working with a functional medicine practitioner, natural healthcare practitioner. In this case, I mean, I'm biased and I'm always going to recommend that, but especially in this case, this is a little bit unique. So I definitely would work with someone, not just like your primary care doctor or endocrinologist, because they're probably not going to be of much help, in my opinion. All right, so I'm going to go another like maybe 6 minutes and then check YouTube, see if there's any other questions. And same thing with YouTube. What I'm going to do is I'm going to, if there's repeat questions on YouTube, I'll just go, I'll see if there's any new questions on YouTube, just because it's not fair. Like, there's less people on YouTube, but I don't want to answer like 5 questions from someone on YouTube and not get to someone on Zoom. So I don't mind answering multiple questions if I get to everybody at least once, but I don't think that's going to happen. So, but again, definitely the week of the 17th, look forward to everyone joining me. So this is a private question from also someone who doesn't look like they asked a question before. So once thyroid levels have normalized and Graves' antibodies are undetectable, what is the best way to wean off methymizole? I'm on 2.5 milligrams per day. So I can't tell you to wean off methymizole, but 2.5 milligrams, so you're taking like half a tablet a day. That's, that's pretty much as low as a dose. I guess you could cut into quarters, but, so most doctors, some will say to get off, but, what I see a lot of doctors do is, just to play it safe, have someone take 2.5 milligrams every other day. And some will even, like, after that do, 3 days a week. But, if someone's doing every other day, let's say, and if antibodies are undetectable, they're probably okay, like, again, so I'm not telling you to do this, but I guess if I was an endocrinologist, I might tell the person do it every other day. And if everything do another thyroid panel, everything looks good, antibodies are still undetectable, I probably wouldn't tell the person to do it 3 days a week or 2 days a week. I probably would just say at that point, stop taking the methimazole. But that would be my approach if I were an endocrinologist. Again, I'm not an endocrinologist, so but again, the good news, 2.5 milligrams a day is such a low dose. And yeah, hopefully your numbers are heading in the right direction. All right, so still having swelling off and on in my neck area. Doctor says it's not the thyroid. So what can this be? Doctor says levels are leveling and I've reduced meds twice on my way to no thyroid meds, but in a year. Any suggestions? Praying all is well. Yep. Yep. Thank you. All is well here. So, I mean, again, make sure they look at TSH, free T4 and free T3, and make sure things are within the optimal range. Because again, a free T3, for example, first of all, sometimes they don't test it. Actually, a lot of times they don't test it, but then free T3 is on, is on the lower side, but within range. That could be a cause. But then also problems with like estrogen dominance can cause swelling. Problems with insulin resistance. Again, I wrote an article not too long ago, a blog post, I think it was early this year or late last year, on thyroid swelling, like 5 causes of thyroid swelling. So if you visit Natural Endocrine Solutions, type in thyroid swelling, you should see that article. But again, insulin resistance, estrogen dominance, could be 2 other factors. All right, so Colleen, do you specialize in mold treatment, as it does cause fatigue and can wreak havoc on the thyroid? Also, what testing do you, or adrenal testing, also what testing do you? Yeah, so to answer your first question, I won't say I specialize in mold treatments, so that's not like my specialty. There are some doctors that's what they do, that's like their main focus. So that being said, I've I have done research. I've attended some courses. I've, went through, actually, I think I was speaking about this yesterday. There's a course, Mold Illness Made Simple, and I forgot the name of the practitioner, but he was trained by Dr. Richie Shoemaker. And then, just recently, there was a conference, an online conference from Great Plains Lab, where they spoke a lot about mold and mycotoxins. They have a mycotoxins test. So I registered for that, but I'm waiting for the recordings. I wasn't able to attend live, but yeah, I mean, I've written some articles on mycotoxins. So I can't say I specialize. Like if someone has thyroid issues, and like Graves or Hashimoto's, let's say, and they also have mold problems, yeah, I definitely will give recommendations. But I can't say people come to me just for molds. I mean, because again, that's not like what my main focus is. So, but you are right. It can cause a lot of symptoms. Can cause fatigue. Just having a high toxic load could also cause fatigue. And the problem with toxic molds, a lot of people are exposed to mold, but people have problems clearing out the mycotoxins, and that could cause a lot of different symptoms. And you might have heard of CIRS, chronic inflammatory response syndrome, which I also spoke about in the article. And yeah, it can also cause problems with thyroid, can cause problems with, pituitary gland. Mycotoxins could potentially affect gut, can cause increased intestinal permeability, leaky gut. And as I mentioned earlier, with adrenal testing, so when I dealt with Graves, I did salivary testing. I like looking at the circadian rhythm of cortisol. Cortisol should be at the highest in the morning and gradually decreasing at the end of the day. And so saliva testing does that. And then the Dutch test, which is a dried urine test, does that as well. And nutrient deficiencies, like I said, there's not one test that I like. So, I mean, I do blood testing. I like hair testing, but hair testing isn't reliable for everything. Like iron, I would not rely on hair testing for iron. And there's, but so I like looking at hair, but I like also blood, sometimes urine. like some of those organic acids testing that has markers that looks at certain nutrient deficiencies. I mentioned methylmalonic acid in the urine, which is a real good marker for B12. All right, so I'm going to go to YouTube, see if there's any new questions from people who haven't asked questions before, and then I'll get back to Zoom. Okay, so treating this, so Les, I don't think we didn't ask. Oh, actually, wow, a lot of questions. Okay. Okay, so Les, you have a bunch of questions. Like I said, I'm trying to, even though YouTube, there's only a few people asking questions, and Zoom, there's so many different questions, and I'm trying to get to everybody at least once. So, so let's see. So does anyone know how to help someone with an overactive thyroid? My numbers are 0.04. Medication also almost killed me. Heart problems from it, couldn't breathe. No help from anyone so far. When you're overactive thyroid, no doctor has a clue. Yeah, that unfortunately is true. Let's see. Treating the symptoms is, as you said, a band-aid. They need to get to the cause of the overactive thyroid. Yeah, I mean, you're right. I mean, when I was dealing with Graves less, you know, so I was diagnosed with hyperthyroidism, and I went to an endocrinologist just to get, you know, the diagnosis. I mean, know what I know now, I really didn't need to go to an endocrinologist because I didn't follow the recommendations. But, you know, at the time, I didn't know what I know now about hyperthyroidism, so I just wanted to go and hear it from an endocrinologist that, you know, I had Graves, and which I did, and you know, but you know, so you're right. They don't do anything except, I mean, the three things they do is either give medication, which again, sometimes is necessary. So I have patients who take the medication, and it is important to be safe while addressing the cause of the problem. But the three treatments, typically medication, surgery, radioactive iodine, and oh yeah, you are very welcome. So yeah, I mean, definitely. So a few different things. One, you know, so again, like I'm telling everybody, attend that free challenge. You know, the free challenge. Visit my website, naturalendocrinesolutions.com, and make sure you're on my mailing list so you get the email. You know, for that, you know, so because I'm going to be sending an email out this weekend or Monday, so it's going to be a free challenge. Again, no strings attached. And so again, I think you'll learn a lot there. My website, a lot of, you know, free articles there, naturalendocrinesolutions.com. My book, which, you know, my book's not free, but, you know, but again, Amazon, you know, natural treatment solutions for hyperthyroidism and Graves' disease. And, you know, also Facebook group. You might want to, if you're on Facebook, there's I have one Graves and Hashimoto's group, and then one that's just on hyperthyroidism. The one with Graves and Hashimoto's has, you know, about 3,800 people, 3,700 people. The one with hyperthyroidism, about 1,700, I think. So again, you could also get support from other people. But if you're really just trying to learn about it, I would say my website, the challenge, maybe my book. All right, so let's get back to Zoom. And let's, before doing that, let's just clearing some of the drawings on my slide. All right, so I'm going to take another quick sip of water. All right, so Laura, what about food sensitivity testing? So, you know, I'm not a big fan of food sensitivity testing. Some practitioners are. There's really no perfect method. I like elimination diet. Again, that's not perfect, but neither is food sensitivity testing. So, but yeah, again, some doctors do that. I can't say I never do it, but usually it's if someone's, yeah, someone's not, if we're not finding answers elsewhere, but it's usually not something I recommend for everybody to get. But and when I do recommend, usually I recommend like Cyrix Labs, Cyrix Labs. There's also one called Ola Test. That's pretty good. So Terry, is there any difference between early onset and later onset Hashimoto's? My middle daughter was diagnosed before the age of 10. Yeah, unfortunately, seeing it more in children. Most of my patients are adults, but I see more people with more children, teenagers with it. So, I mean, I'll say the main difference is if you catch it early, there's a greater chance of it, being addressed. Like the longer you have it, the potentially the more damage that can take place to the thyroid. And even though the thyroid gland can regenerate, it's not as quick as regenerating as other areas of the body, such as like the gut and the liver. So that's one advantage. But obviously they're both autoimmune, both, involve whether it's early onset or someone doesn't get diagnosed until, like the 30s, 40s or later, later 50s, 60s, still trying to remove the trigger, trying to heal the gut. And it's not always easier. You would assume, maybe some people might assume that with children, that it might not be as long of a process getting them into remission, but that's not always the case. I mean, by the time Hashimoto's is diagnosed, it's usually been there for a number of years. So if someone has had it, let's say if they were diagnosed at 8 or 9 years old, it's not, those antibodies were present years before that. But again, it's, still a better situation like than someone who's like, 40 years old, let's say, or 50 years old, and, they've been having damage to the thyroid take place for like 10, 15 years, but, it wasn't showing up in a blood well, it's not that it wasn't showing up. They probably didn't test the blood, and sometimes it won't show up just looking at TSH, which is what most doctors do. So sometimes with a physical, they might look at TSH, but it looks fine, or looks fine from a lab perspective, might be, outside the optimal range. But again, most medical doctors don't look at the optimal range. They're just looking at the lab range. All right, so Rich, my endocrinologist have been trying to wean me off of methimazole to see if I will go into remission. The first time I went off my thyroid levels started creeping towards hyper again. I ended up with ulcers and digestive issues. I started AIP and low dose of methimazole, and I've now been weaned off methimazole again. I wonder about the possibility of going to remission by diet change alone. I mean, it's possible. So some people diet, that's all they need to do, but that, for a lot of people, that's not the case. So I think it's a good starting point, and there are some people that's all, in the Facebook group, I do see some people post where they went on AIP and that's all they needed to do. But I see a number of people where they did AIP and it wasn't enough. So I guess you could always see how just diet and stress management and, getting proper sleep, just diet and lifestyle, that might very well do the trick. Okay, so let's see again, trying to make sure I get to everybody, like I said, at least once. So if I skip over any questions, it's probably because, again, I've answered at least one. And again, I'm pretty sure I won't get to everybody at least once. And I apologize if I don't get to your question. Again, make sure week of May 17th, you sign up for the challenge, and I'll get that email out in a few days, no later than Monday. So Juanita, how soon can I feel and start seeing my health improve after a trigger has been removed? Root canal removed, would blood work soon after determined this was a main trigger to Graves? It could still take a few months. I mean, even like if someone, gets treated for an infection like H. pylori, or, again, a root canal, if that was the cause, let's say, more likely, like I'll say root canals are, even though I'm not a big fan of root canals, but there's not a lot of evidence about root canals being triggers. And I've had people, I don't know if I've ever had anybody remove a root canal and get in remission. I've had some people get mercury fillings removed and get into remission. Even that wasn't like immediate where they got it removed and the next test, the antibodies, everything was normal. Usually it does take some time. So it could take a few months. But again, root canals, I think, either way, it's not a bad idea to get it removed. It depends. I won't get into that because that's just my opinion. I'm not a dentist, but the person who typing this in probably agrees with me because she did get it removed, but then there might be, I don't want to open up a can of worm. And if someone, I'm sure there are people who have root canals who have no intentions of getting it removed, but there's some controversy with root canals that you can never get rid of the infection. So that's why I'm bringing that up. And I wrote about that on my website, but like I said, I'm not a dentist. So, I would speak with a biological dentist if you want more information on that. Even though I might speak a little bit about that on, the week of the 17th. Eventually, I might also interview my biological dentist, even though I haven't asked him to do that, but I might get him on the Facebook Live and have him talk about it. So. All right, so I have borderline TSI and my endocrinologist says I have Graves' disease. How quickly could I remedy this just by being borderline? The only symptom I've experienced is palpitations, inward tremors, and fatigue on medication, which cleared out symptoms. Yeah, if your TSI, so yeah, when it is higher, like when someone has really high TSI, everybody's different. So I can't say it always takes longer. Sometimes it depends on how soon you find or remove the trigger, honestly. But if in two situations, someone has high TSI, really high TSI, someone has like a borderline high TSI, and in both cases, the trigger, let's say the trigger and underlying imbalances are found and corrected, found and removed as far as the triggers, this like the same amount of time, then yeah, typically the one with the lowest TSI will get into remission sooner. But the problem is it's not always equal. It can take a longer amount of time for the one with the borderline TSI to remove their triggers, to find and remove their triggers. So it probably still will take some time. It's probably not going to be like, a 1 or 2 month process. So it's, but really just try that, I'm glad the medication cleared up the symptoms. But again, there's some reason why you have a TSI, elevated TSI. Maybe it's, some food triggers, and just cleaning up your diet will be good enough. Maybe though there's something else underlying. All right, so Elizabeth, I don't think I answered a question from you. So please clarify how erratic TSH levels and replacement therapy with triiodothyronine, so T3, might affect atrial fibrillation. Thank you. Also, how often to test levels. All right, so erratic TSH levels. And so, I don't know if, I'm not sure if I completely understand, but so again, T3, so hopefully you got more than just TSH if you're taking T3. So yeah, T3, yeah, atrial fibrillation, you would want to be cautious, but as long as you're, I would probably say if you're dealing with AFib, you might want to test sooner than later, maybe like 2 to 4 weeks, because you definitely don't want to be hyper. And you might be able to tell just by how you feel, but in this case, I wouldn't take the chance. So, hopefully taking a low dose, like 5 micrograms or something like that of the T3, and then do a test and just see, and then also, monitor your symptoms as well. So yeah, most of the time I won't say to test 2 to 4 weeks. Most time I'd say, like 4 to 6 weeks would be like the earliest. And, many of my patients, it's every couple of months, but, in this situation, I would probably say initially at least like 2 to 4 weeks. All right, so Stephanie, I don't think I answered a question from you. So I've been diagnosed with Graves, hyperthyroidism, and moderate hyperthyroidism. What are the causes of that? Are there certain foods I need to avoid? Yeah, so visit my website. And also attend the free challenge the week of the 17th. So I recommend for most people, again, there's no diet that fits everyone perfectly. So you might hear me talk about autoimmune paleo diet, and you could learn more about that on my website. Some people, it's just a regular paleo diet just because they might struggle with AIP, autoimmune paleo diet. So autoimmune paleo, I mean, so you want to eat whole healthy foods, avoid refined foods, avoid sugar. I would say avoid common allergens. Like, with my patients, I tell them to avoid gluten, dairy, corn, I mean, grains and, so someone's just paleo, they're still going to avoid gluten, dairy, grains, uh, refined food, sugars, unhealthy oils like canola oil, for example. If someone's AIP, autoimmune paleo, they're going to take it a step further, avoid nightshades, so which they have compounds that could have a negative effect on the gut, can cause inflammation in general. So nightshades are tomatoes, eggplant, white potatoes, peppers. Autoimmune paleo, so they're excluding eggs and nuts. For some people, that might sound like a crazy diet to follow, but there is some science behind it. If you want to learn more, you might want to follow Sarah Ballantyne, but also you could do some reading on my website as well, naturalendocrinesolutions.com. All right. Scrolling down here in Zoom. That's one thing I like about, I don't like Facebook, but I do Facebook lives because a few reasons. One, there's a lot of people still on Facebook. Like I said, I have a large following in my groups, but I will say I use StreamYard for when I do my face, which I like so much better than Zoom. It's just I could stream to different locations, and then I could also post the comments so everybody could see the comments. And here, even so, it's like tedious, like trying to find the comments in Zoom. Like it's just not easy. So, but let's see. So my grandmother had Addison's, and I was recently diagnosed with Graves. What are my chances of getting Addison's? So I hear Graves can set you up for other autoimmune diseases. So that is true. So yeah, you have one autoimmune condition, then you have more likelihood to have another autoimmune condition. And I don't know the odds. I mean, I'd still say it's probably, it's not like, like 80%, but, definitely increased. And I would just do everything you can. I wouldn't worry about the odds as long as you're doing things to improve your immune health. You can only do what you could do. So I wouldn't like stress about it. I'm not, so I'm not saying not to do anything. I'm saying the opposite. Don't worry about it, but just, address the autoimmune component of Graves, which again, I'll be talking about during the Accelerated Thyroid Healing Challenge. I talk about on my website, naturalendocrinesolutions.com, my book. So again, there's definitely resources out there. Can you spell Thyrogold? So it's Thyrogold. All right, so I'm gonna answer a few quick questions on because I see YouTube, there's a few people who didn't get who just are kind of new and ask questions, and then I'm gonna go a few extra minutes on Zoom. I said I'd be done like 9:15, and I do have to wake up early tomorrow. Unfortunately, I got to wake up during the week most days, like not the weekends, but Monday through Friday at 5:10, just because my daughter goes to school really early. Anyway, so yeah, I'm not going to go like too much longer, just because even if I went to bed now, I wouldn't get 8 hours sleep. But like I said, I wanted to do an evening one just because I feel bad because I do mostly day ones. But during the challenge, the week of May 17th, I will be doing some evening ones too. So Thea asks, have you seen a connection between thyroid nodules and uterine fibroids? Yeah, there actually is a journal article that talks about the relationship. So typically we're looking at estrogen metabolism problem with estrogen. And then Susan, any recommendations on dealing with hot flashes? Diagnosed with Hashimoto's in September 2014. I've had 15 to 20 hot flashes every day since early 2014 while undergoing chemo for hormone positive breast cancer. So Again, check out my website, naturalendocrinesolutions.com. And I did write an article on hot flashes a few years ago. But I will say you need healthy adrenals to have healthy sex hormones. So again, you obviously, you had some, sounds like maybe estrogen dominance, estrogen metabolism problems with the hormone positive breast cancer. But so obviously you wouldn't want to take estrogen, but you would want to do things to improve your adrenal health. So I don't know if you might be a real good candidate for doing like the Dutch test, dried urine test, because that looks at adrenals, circadian rhythm of adrenals, but also looks at estrogen metabolism, which is big for anyone with a history of breast cancer, hormone positive breast cancer. So you might want to, get that test done. Of course, I'm going to recommend working with a practitioner. All right, so let's, okay, you are very welcome, Thea. Okay, just going to answer a few more questions. Again, I know I'm not going to get to everybody. I'm trying to my best, but there's so many questions, which again, I love that there is a lot of people asking questions, but yeah, like I said, I need to go to bed soon, try to get at least seven hours tonight. All right, so Tracy, I don't think I answered a question from you, so at least I don't remember. So I have Hashimoto's, antibodies currently 327. Doctor is suggesting I stop armored thyroid completely and instead supplement with iodine and selenium. I've been on thyroid meds for 20 years. This seems like a very bad idea to stop armor completely. Yeah, that's, I mean, I don't know what your thyroid panel looks like, but either way, if it looks good, it could be, it probably, the armor is probably playing a role in that. So yeah, that's, I would agree, especially with Hashimoto's. I mean, I'm not anti-iodine, but there is evidence that iodine can cause problems with Hashimoto's. So yeah, I would agree. I would be very cautious about stopping armor, and then again the iodine, even though they're recommending iodine with selenium, but still. But even just even if anyway, so yeah, I agree with you, Tracy. Okay, new labs T3 2.6, T4 1.1, TSH 0.978, but I'm on meds 5 days a week, meds until 12/21. I want off on all bugleweed. So I'm not sure of your question, but yeah, I don't understand the question. So the labs, I mean, they don't look too bad. T3 a little bit on the lower side. T4 looks pretty good. TSH a little bit less than optimal. On meds 5 days a week. So if you're on the like anti-thyroid medication, seems like it's doing its job. I can't tell you to like switch. I mean, some of my patients would make the switch to bugleweed. This is like kind of out of the scope here to do that. So all right, Suzanne. So I'm going to answer 3 more questions and then I'm going to call it a night. So Suzanne, I had appendicitis and peritonitis last year. They've been resolved. I was also diagnosed with Graves' disease in 2017. Now that my leaky appendix issue has been resolved, would you expect to see an improvement or remission of my Graves' disease? I'm currently taking methimazole. Thanks. It depends. The appendicitis, I mean, again, leaky gut. I mean, I know you said leaky appendix, but it depends if that was the main cause. There could have been other issues. That could have been the main factor. Could have, and if it was, then yeah, I would say those being resolved. That should really be the main factors in getting into remission. But there could be other things too as well. And that could have just been like a contributing factor. So yeah, hopefully I would expect, maybe to see an improvement. Remission, maybe not. I wouldn't be discouraged if you're not in remission. I mean, again, I'm sure I would get discouraged, but knowing what I know now, I would just be like, okay, that's not the main trigger. There's other triggers, underlying imbalances. Okay, so Judy, I don't think you asked a question. So does thyroid issues affect your memory? It could, yeah. I mean, thyroid issues, either high or low thyroid, definitely low thyroid, because like I said, thyroid hormone affects every cell tissue in your body. But yeah, even hyperthyroidism, sometimes that could affect memory, cognition as well. Okay, so, all right, so this will be the last question I ask. Suggestions for, or last questions I answer. So suggestions for those, and again, if I didn't get, one more time, if I didn't get to your question, I apologize, but week of May 17th, I'll be doing these Zoom calls every single day, Zoom to Facebook. I'm not going to do Zoom to YouTube because a lot of the challenge will be taking place. You don't have to be on Facebook, but a lot of the engagement will take place on Facebook. So I'm going to live stream into the Facebook group, but there'll be Zoom calls. If you're not on Facebook, just you could sign up for the Zoom calls, and I'll be doing, Zoom. So, some of them will be during the day, some of them will be evening, at 8 o'clock, like I'm doing now. So, so suggestions for those who want to go as natural as possible, but also cannot do mammal products, no glandulars or armor. Just look at Thyrogold, and it still is made with mammal byproducts. I mean, there's really, there's no substitute for thyroid hormone. So if someone needs thyroid hormone, it's either got to be synthetic or, desiccated. So like glandular, armor, NP thyroid, nature thyroid, WP thyroid, or glandular. And if you're not looking to do that, then maybe something like Tirosint, it is synthetic, but it's hypoallergenic. Or go to a compound pharmacy. Again, it's going to be synthetic. There's no like herb, that you could take. Like there's, things like ashwagandha, which, it's a member of the nightshade family, but that aside, a lot of people do fine with ashwagandha. So that affects the HPT axis, hypothalamic pituitary thyroid axis, potentially can stimulate thyroid hormone production. But if someone has, thyroid hormone deficiencies, due to, let's say, like Hashimoto's, taking something like ashwagandha or other herbs, is not going to be the solution. So sometimes, again, I get it. When I dealt with bugleweed, when I dealt with Graves, I don't take the medication. I took the bugleweed. But like I said, some of my patients do take the antithyroid medication, and everything's risk versus benefits. And when it comes to, if someone's like a vegan, vegetarian, and, they have hypothyroidism and they don't want anything to do with the glandulars, which I understand, but they also don't want anything synthetic. There's no other solution that I know of. If someone, not everybody will need thyroid hormone, but if someone needs it, then if they don't want to take the glandulars or the desiccated, then again, that's where the synthetic, and like I said, but I would go more as hypoallergenic as I can. So I wrote an article on Tirosint, but then you might also decide to, go to, you won't be able to go directly to a compound pharmacy, but work with a practitioner who's willing to, write a prescription to, where you could take it to a compound pharmacy, get something made that's hypoallergenic. All right. So again, everyone, thank you for attending and for your questions. And like I said, I know I've said this like, who knows how many times, but I apologize that I didn't get to all questions. The week of 5/17, I'll be having my 5-day challenge. And again, that's a big reason I do it, just to teach you things. So it's not just going to be answering questions. You'll be getting lessons every day. And then when I do the Zoom calls, there's going to be like a lesson, maybe like, again, 10, 15, 20 minutes, and then a follow with Q&A. And then there's going to be separate 2 Q&A sessions, one at 12 and I think one at 8 o'clock, either 8 or 9 o'clock. It might be 9 because anyway, but either way, there's going to be day and evening Zoom calls. And so my goal that week is to answer everyone's at least most important questions, like their top, 2 or 3 questions. So yeah, so anyway, thanks again for tuning in, and again, the registration will be available no later than next Monday, which is May 10th. But thanks everyone for attending. I do appreciate it. And hope everyone has a wonderful evening. And again, hope to see a lot of people at the challenge. So again, take care, everyone. Have a wonderful night, and thanks again for tuning in.